Why is it so important to co-create to ensure that we have a more equitable world?
Yeah, I think so. For me, when I think about co-creation, I think about community and partnership and finding solutions together rather than for. And, so throughout my career, I've been in environments where we have the folks who have the education, myself included, specific professional experience, and there is an identified health problem, and we're going to go fix that health problem with the data and the evidence that we have, right? And often we'll bring that to communities and populations, and we haven't even asked them what the problem is, right? And so it's that kind of paternalistic, exclusionary approach that I think is something I've just seen repeatedly over the 20 plus years that I've been in the field. And so co-creation has become really the center of my focus in all my work. And it's a recognition that through co-creating and everybody having a voice and everybody's ideas kind of contributing to other ideas, it's a little humbling to recognize that it's just that solutions are going to be better. So I have maybe one idea, but the reality is my idea is built on the ideas of everybody I talk to. And it just gets reshaped a little bit. And then I talk to another person and learn from them and it gets reshaped. And so there's sort of this art of collaboration and recognizing that nothing happens in a vacuum. And I've just found that to be a real driving force and motivation for me, is to do work in partnership.
I appreciate you raising up the fact that the paternalistic system, the system just generally saying, okay, this is the issue that this community has, let's give them this solution, without actually giving a meaningful voice to the community, just creates the issue within itself. Because if you're talking about, I don't know, substance misuse, but the community is concerned about affordable housing, then there's a mismatch in where they see where the resources are, where the needs are, where the impact is, and to the point of course we have expertise, and the expertise is valued, but it's never valuable unless it's aligned with that community expertise, with that lived experience. To your point, all the ideas that we have are built off of the ideas that we've had from our experiences and from the interactions that we've had. And then people that are most impacted by the issues, many times the issues that we are trying to work with community to solve, have very different lived experiences, and they can give us a very different perspective. And I think that's going back to the importance of that collaboration and ensuring that there is the community voice in that work.
Yeah, and that it's driven by, that there's no solving a problem for somebody. And are you even asking what is the problem and can I help you with this or not? That's just been a theme that I've seen come up repeatedly. It's even in the increased use of community health workers to do pieces of work very early in my career, where we use the term peer educators, and there was this sense that, wait a minute, they don't have the education that we do to understand whatever theory of, whatever it is that we're trying to accomplish. And yet that person was often, if not always, just more poised to have meaningful impact in their community.
Yeah, it really goes to show that we need humble solutions mixed with expertise to get to realistic goals. And one of the things that I always talk about is the systems have been created because the people that have at the tables created those systems. And if we don't give voice, space, new tables to people who have not been a part of those conversations, then we end up in the same position that we are in today.